Imagine this situation. You are over 50. You wake up in the morning, carefully sit on the edge of the bed, and feel that familiar pulling sensation in your lower back again. Sometimes it's a dull ache, sometimes a sharp shooting pain that appears when you simply bend down to tie your shoelaces. Many men at this moment think the same thing. Well, I guess it's age. My back isn't what it used to be. But here's the interesting part. Very often, the cause of this pain has nothing to do with age and not even with the spine. Over the years, doctors have increasingly noticed a strange pattern. Men come in with chronic back pain, get x-rays, undergo examinations, and it turns out that their spine is not that bad at all. No serious herniations, no destroyed discs. And then the main question arises, if the problem isn't in the back, then where is it? The truth is that there are several completely unexpected factors that can cause or exacerbate back pain. Many men over 50 face these issues every day, often without realizing it. Moreover, some of these causes are not related to movement, but rather to what you eat, how you sit, how your body functions internally, and what small habits have become part of your daily life. I have seen stories of people who have suffered with back pain for years, trying massages, ointments, exercises, only to find that the real cause was something they had never even considered. And once that factor was addressed, the pain gradually began to subside. In this video, we will explore 4 completely unexpected causes of back pain that are rarely discussed. One of them is related to your breakfast. Another is a habit that seems completely harmless. And the third can literally turn off the muscles that are supposed to protect your spine. And the most interesting thing is that when you learn about these things, you will have the chance not just to temporarily relieve the pain, but to understand what exactly your body is trying to tell you. When it comes to back pain, most people immediately picture the spine, worn out discs, pinched nerves, poor posture, or the consequences of heavy physical work. And yes, sometimes that is indeed the cause. But for many men over 50, the situation turns out to be much more complex and much more interesting. The fact is that the back is not just a set of bones and muscles. It is part of a vast system where everything is interconnected. Muscles, nerves, hormones, metabolism, and even the functioning of internal organs can directly affect how your spine feels. Imagine a bridge. If one of the supports begins to weaken, the load is distributed incorrectly, and tension appears in places where it wasn't before. The same thing happens with your body. As we age, natural changes occur in the body. Muscles gradually lose strength, the levels of certain hormones decrease, and tissue recovery slows down. But here's what's important. Sometimes pain arises not from aging itself, but from small processes that gradually turn on inflammation in the body. This can be hidden inflammation due to certain foods, poor sleep, or even chronic stress. When inflammation appears in the body, the muscles around the spine begin to function differently. They can become tense, stiff, or on the contrary, too weak to stabilize the back. As a result, the spine starts to bear loads it was not prepared for, and you feel this as pain, stiffness, or uncomfortable pressure in the lower back. There is also one more unexpected mechanism. Some habits literally turn off the deep core muscles, the very muscles that work as a natural corset for the spine. When they stop doing their job, all the load falls on the lower back. Interestingly, recent studies show that for many people, chronic back pain is linked not so much to injuries as to lifestyle, diet, activity level, stress, and even gut health. All of this can affect inflammation, muscle tone, and the nervous system. That is why today doctors are increasingly looking at the problem more broadly. Instead of just treating the back, they try to find hidden factors that cause it to hurt. And this is where the most interesting part begins, because some of these causes are so unexpected that most men don't even suspect them. When men first hear about the hidden causes of back pain, many expect something complicated, expensive procedures, long workouts, or strict restrictions. But the reality is often much simpler. Sometimes small changes in habits can significantly relieve the spine and help the body function as it should again. Let's talk about 4 surprising factors that can subtly trigger back pain and what can be done starting today. The first factor is chronic dehydration. It sounds almost too simple, but water plays a huge role in spinal health. Intervertebral discs act as shock absorbers between the vertebrae, and a large part of their structure consists of water. When the body does not receive enough fluids, the discs gradually lose their elasticity. They become less flexible and struggle to handle loads. As a result, even ordinary movements, bending, turning, lifting a bag, start to create additional pressure on the lower back. Many men over 50 simply stop drinking enough water throughout the day, replacing it with coffee or tea. A simple rule can change the situation. Start the morning with a glass of water and try to drink evenly throughout the day. For most people, this is about 6 to 8 glasses, but listen to your body's feelings. After just a few weeks, the tissues begin to retain moisture better and the spine feels it. The second unexpected reason is weak glute muscles. Yes, the glutes. They are among the strongest muscles in the body and play a key role in supporting the pelvis and lower back. However, due to a sedentary lifestyle, these muscles literally fall asleep. When you sit for hours in the car, at the computer, on the couch, the glute muscles stop working actively. Then the lower back starts to take over their job. Imagine a small team trying to do the work of an entire construction crew. Over time, this leads to overload and pain. The solution is surprisingly simple. Regularly activate these muscles. Even a few simple movements a day, such as slow squats, pelvic lifts while lying on your back, or a regular brisk walk, help wake up the glutes and restore their role in supporting the spine. The third reason is hidden inflammation due to diet. Some foods can exacerbate inflammatory processes in the body, especially if they are regularly present in the diet. Excessive amounts of sugar, ultra-processed foods, and large amounts of refined flour can all support a state of mild chronic inflammation. When inflammation increases, muscles and joints become more sensitive. The back starts to react to loads more strongly than before. There is no need to radically change the entire diet here. Start with simple steps. Add more vegetables, fish, nuts, and foods with natural fats. Gradually reduce the amount of sugary drinks and heavily processed foods. Many people notice that the body becomes less stiff within just a few weeks. And the fourth unexpected reason is breathing. Yes, it is breathing that can affect your back. When breathing becomes shallow and occurs only in the chest, the deep abdominal muscles and core are hardly engaged. Yet it is these muscles that stabilize the spine. If these muscles are inactive, the lower back is forced to take on extra load again. A simple exercise can change the situation. A few times a day, take a slow, deep breath through your nose, allowing your belly to gently expand, and then slowly exhale. This diaphragmatic breathing gently activates the core muscles and helps the spine feel more supported. When you start to combine these simple elements, adequate water intake, activation of the gluteal muscles, more anti-inflammatory nutrition, and deep breathing, the body gradually returns to its natural balance. The spine stops working in a state of constant overload, and the muscles begin to perform their functions again. Of course, it's not a magic button that removes pain in one day, but for many men, these small changes become the turning point when the back finally starts to feel relief. Sometimes men begin to take care of their backs, do exercises, drink more water, try to move, but the pain still returns. In such situations, the reason often lies not in what you are doing wrong, but in several common mistakes that can completely negate all efforts. One of the most common mistakes is trying to fix the back only with stretching. Many people think that if the lower back hurts, it needs to be constantly pulled and stretched. At first glance, this brings relief, and the muscles can indeed relax a bit. But if the problem lies in weak core or glute muscles, excessive stretching can even increase spinal instability. Imagine a rope that is already weakened and you keep stretching it. At some point, it simply stops bearing the load. Therefore, it is important to combine light stretching with exercises that strengthen the supporting muscles. Another mistake is sitting for too long without moving. Many men spend hours driving in front of the television or at the computer. Even if you exercise once a day, it does not fully compensate for 8 or 10 hours of sitting. When the body remains in one position for a long time, the muscles around the spine gradually shut down, circulation slows, and pressure on the lower back increases. A simple rule can help. Try to stand up and move a little every 30 to 40 minutes. Even a short walk around the room or a few light movements can restart the muscles. The third mistake is ignoring the body's signals. Sometimes men endure pain for months, considering it a normal part of aging, but constant severe pain, numbness, weakness in the legs, or a sudden decline in mobility are signs that should not be ignored. In such cases, it is important to see a doctor to rule out more serious problems. And one more important point is the sudden changes in training. Sometimes, after watching a motivational video, a person decides to immediately do intense exercises, lift heavy weights, or perform complex movements. But if the muscles have been inactive for a long time, a sudden load can cause even more tension and inflammation. It is much safer to start gradually, giving the body time to adapt. It is also worth remembering about medications and chronic diseases. Some medications, especially those affecting the muscles or nervous system, can alter the sensation of pain or energy levels. Therefore, any serious changes in physical activity are best discussed with a doctor, especially if you have issues with your heart, joints, or metabolism. By avoiding these common mistakes, you give your body a chance to truly recover rather than just temporarily suppressing symptoms. So, let's take a moment to pause and remember the main point. Back pain after 50 is not always just age. Very often it is related to unexpected factors that most men don't even consider. Sometimes it's not about the spine itself, but how the whole body functions. A lack of water can deprive the intervertebral discs of their natural elasticity. Weak or sleeping gluteal muscles can shift the entire load onto the lower back. Nutrition that causes hidden inflammation can increase the sensitivity of muscles and joints. And even shallow breathing can disable the deep muscles that should protect your spine like a natural corset. The good news is that all of these things are under your control. Small daily changes can gradually alter how your back feels. Try drinking more water throughout the day. Add a few simple movements that activate your glute muscles. Pay attention to your nutrition by reducing the amount of heavily processed foods and adding more natural foods. And from time to time, remind yourself to take a few deep, slow breaths, allowing your body to engage the core muscles. Now, a little experiment. For the next 7 days, try to incorporate these 4 simple habits. There's no need for anything radical. Just observe your body. Notice how the feeling in your lower back changes in the morning, after a walk, or by the end of the day. Sometimes, even small changes can yield results you didn't expect. And I am very interested to know your opinion. Write in the comments, have you ever experienced back pain and what, in your experience, helped you the most? Your stories can help other men who are going through the same thing right now. If this video was helpful to you, please like it. This way, more people will be able to see it. Share it with a friend or relative who might benefit from this information. And of course, subscribe to the channel so you don't miss new videos about natural ways to maintain health, energy, and strength after 50. Sometimes just a little bit of knowledge can change how you feel every day.